Okay, good afternoon, everyone. I'm Lifeline's Network Engagement Coordinator, Tom Shukas, and I want to thank you all for joining us for today's Lifeline webinar, where we're going to be discussing the results of the 2018 Crisis Center Network Survey conducted last fall. For anyone who's joining this webinar and may not know what the survey was, very briefly, the Crisis Center Network Survey is something that the Lifeline conducts every 3 years as a better way to understand our national network of crisis centers. We're going to talk, obviously, a lot more about that and what we found out. Joining us today from the National Suicide Prevention Lifeline to speak on these survey results are Executive Director John Draper and Associate Project Director Sherry Sinwelski. And before I hand it over to John, just want to say a couple of housekeeping things. As a disclaimer, the views, policies, and opinions expressed in written conference materials or publication and by speakers and moderators do not necessarily reflect the views, opinions, or policies of SAMHSA or HHS, nor does mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. And of course, if you could, dialing in by phone or through the computer, please mute your audio to avoid any background noise so that way we can all hear the presentation. And if you would like to ask questions during and certainly toward the end of the presentation when we have a little Q&A opportunity, feel free to ask those questions or make any comments you'd like in the chat box. And with that, I'd like to pass it along to John.
Greetings, everyone. I hope you can hear me all right. Tom, does that sound all right?
Yep.
Good, good. So let's see if we can move on to the next slide, Tom. Talk a little bit about the purpose of the network survey, the summary of the results, and we'll do next steps and discussion after that. Tom, go ahead and move on to the next. So the purpose of the network survey, first of all, there's reasons for us to have this information. There's also reasons for you to have this information. It really helps us having a sense of how you all are doing, what your challenges, what your needs are. That all informs our discussions with stakeholders at every level, anywhere from state and local stakeholders to federal stakeholders, anywhere from folks in Congress to our national partners such as AFSP or SAVE or others who want to speak on your behalf. So it really gives us a sense to be able to say, here's a snapshot of who our centers are and what they're doing. There's a lot of things that we like to talk about that I like to say about our centers that this helps me say. Things like the amount of training and relationships that you all have with local crisis and emergency services. Those kinds of things I think are really important for our stakeholders to understand why a network of local centers is very important. It's also important for us to get a sense of what some of your strengths are. So what are some of the areas in which you all specialize? There may be specific cultural groups or special skills that you've honed at either at the behest of stakeholders that are funding you to experiment and innovate, to just the calls and needs of your community may be very different and require you to provide different types of services. And as we have that information from you, we can share that with the network with your permission and say, here's what Center X is doing for this population. It also allows us to put you in connection with each other and say, well, did you know that this group happens to be serving youth with these kinds of cultural needs just like you are? Might be great for you all to connect. And similarly, this enables us to be able to highlight some of the things that all of our network centers are doing in very special ways. We also at times have a call or a need for establishing work groups on special practice areas, as well as panels and workshops at conferences that you all can help be spokespersons for when we're needing to illustrate some of the strengths and value and perhaps needs of the Crisis Center Network. Next slide, Tom. So let's go right to the results. Now, just to give you a sense as to how many participated and what time period this covers, as Tom mentioned, we did a survey in 2011, we did one in 2014, and then we also surveyed the period of June 30th, 2017 through June 30th, 2018. So we could compare these trends. Some of those comparisons will be available in this discussion and further in a paper that we'll be putting out next month. About 70% of our Lifeline centers in the network at the time that this was conducted were participated in filling out the survey. And those centers that did participate, again, nearly 70%, account for a little bit over 80% of our calls. So I would say it's a fairly representative picture that we're providing you of the network as a whole. Tom, next one. So who and what are the organizations in our network? A very general overview is really from the perspective of nonprofit organizations versus government organizations or others. And we compared that, what it looked like in 2015 versus 2018. And we see roughly the same percentage of nonprofits, about 4 or 5 out of our network centers are nonprofit organizations. And you see a slight uptick, about 4% increase in government agencies that are operating a Lifeline center in the network. Tom, next. So looking at the overall call volume for our crisis centers, and this specifically relates to what percentage, what slice of the pie of your total calls are Lifeline calls on average, at least they were for that year. And what we saw is about a 19% proportion of calls that went to our crisis centers were Lifeline center calls, or Lifeline volume specifically. And when they were Lifeline calls, about 53% of the time, they related to mental health or suicidal related crises. Next one, Tom. So when we look at that 19% number, that proportional number, how does that stack up to previous fiscal years? So as again noted just last year, about 1 in 5 of the calls were Lifeline calls that went to our centers. But you see in fiscal years 16 and 17, fewer calls than we're getting now. Every year they tend to go up. In fiscal year 2011, we saw about 12% of the total proportion of Lifeline, total proportion of calls answered by our local centers were Lifeline calls. And again, you see 15%, 17%, and now ascending to 19%. So more and more of our calls are being answered at local centers that are Lifeline calls. But what you're also seeing, if you look at those bars, is an increase in calls every year. So while it's a significant increase in proportion, you're also seeing a big increase in calls. So our centers are being strapped not only by Lifeline calls, but by an increase in local calls. No surprise, I'm sure, to many of you. Tom, next one. So really, how are they managing this? I mean, I know all of you are answering multiple lines, and many of you have specialized lines, and some of these lines are being supported through other funds, and you may be able to share some staff, which enables you to have a little bit more Lifeline capacity than you might otherwise. But we see quite a number of centers that are doing 2-on-1 work. It's interesting, and that was something we're pretty aware of, that approximately anywhere from I think about 34 of our centers overall are doing 2-on-1 work, so this is a little underrepresented of the total numbers. But you'll see also that we have a number of dedicated lines for youth, for young people, which is clearly a great interest of funders, as is substance abuse services that are specifically dedicated for that purpose. It's also heartening to see that there's a pretty good number of warm line and peer support resources provided across our network, and hopefully there will be more over time. You can see the spread of some of the others there as well. Tom, you want to go to the next? So how are our centers being funded, or to what degree are they being funded? And in this case, what we're seeing is about 50% of the Lifeline centers are operating at annual revenue of $650,000 or less. And then the other half is naturally above $650,000. We see about 25% of the centers that are in our network answering calls at $1.7 million annual and above. You want to go to the next slide? So if you compare it to 2015, it's an interesting comparison, and you're beginning to see some of the funding shifts that we found very surprising over the last few years. What you see, for example, was that the lion's share of calls, 63% in 2015, were being answered by those centers that were making $650,000 or less a year. But what we see now is that's actually down to about 50%, with more of the calls being answered than before by centers that are better funded. Let's look at that even more specifically in the next slide. What we see here is that about 65% of Lifeline affiliated centers are report operating with annual budgets of less than $1 million. And I'll talk about how that trend looks overall in just a moment. But regardless of what trends may indicate that there's a growing number of funds flowing to our crisis centers, there's still a significant proportion of our crisis centers that are not being paid explicitly to answer Lifeline calls. So really not quite 2/3, about 60% of our centers report that they have no specific funds to answer Lifeline calls, which is, of course, of great concern to all of us. Nearly half of our crisis center budgets went to hotline calls, including the Lifeline. So the centers are making significant investments in making sure the calls are answered, but they're having to come from a variety of sources, not just from federal, state, and local funds to support the Lifeline. Next. So here's what we're seeing in terms of overall trends in funding for our crisis centers. What you see I'll go over the rows and columns. This is kind of a complicated looking chart. You'll see on the left side of what you're looking at is a column marked private, and the other side is public funds. And then you see in the rows, and you'll see them labeled at the right, quantiles or different quarters of basically our crisis center network sliced into 4 quarters by virtue of how much funding they're getting. And what I thought was interesting about this chart is you'll see, the centers that are receiving the most funds continue to receive more funds, but they're also receiving more cuts, and specifically in the public area. So the centers, not surprisingly, that are making the most or have the most revenue are also the most publicly funded of the group. So those governments that are particularly committed to Lifeline centers or crisis centers in the Lifeline network are also seeing more often a proportional increase in calls. And you'll see that for every single one of these quantiles is a slight increase in funding, which is pretty remarkable. Again, you're seeing mostly public funding increases, not a lot of private funding increases, and mostly because there's a greater trend in government support for crisis service systems. Well, how does that look specifically here for the Lifeline? Let's take a look at the next slide. When you look at it in terms of the trends over the last few years, to put this in perspective, when you compare this last year to 2014 to 2011, if you look at the top line and the bottom line of the slide, the top line shows from 2018 in descending order back to 2011, the rate of increases in funding reported across our crisis center network. It is stunning to see on the heels of the recession in 2011 to what has happened most recently in 2018. 16% of our centers reported an increase in 2011, 23% in 2014, and 66% in this last year. And if you look at the bottom, you see the number that have reported funding cuts. In 2011, half of our centers said that they had funding cuts, 31% in 2014, and really only 21% very good news in 2018. And where we're seeing most of those funding cuts are in crisis centers that are bringing annual revenue of about $245,000 or less. So what's happening is it sounds like some of those smaller centers, some of that funding that might have otherwise gone to them is going now to other centers, which the public funds seem to be more committed to. Next slide. So the last slide I want to mention before turning it over to Sherry, who's going to talk more about some of the operational metrics that we've been getting in terms of survey responses. I want to talk a little bit about what's the impact that our crisis centers believe an N11 number might have on them. None of these are a great surprise to you. As, the majority of our centers, about 79%, said, yeah, an N11 number would increase the call volume and it would impact our center operations. And just over half said it would increase the visibility of their center. So being part of an N11 network, many believe would help people recognize the work that you're doing more clearly. But less than half, surprisingly, said that they thought an N11 number may strain their capacity. But again, about 2/3 said, but we wouldn't have to worry about that and won't worry about that if we have more funding. And we from our perspective, 2/3 support, I think, what we all know is the case, that it's going to be important for crisis centers participating in 911 to have more funding to be able to sustain volume demands in that event. I want to turn it over to Sherry, who's going to walk us through some of the other survey results. Sherry?
Yeah, thank you, John. First of all, I just wanted to thank everybody who's on the webinar today for hearing all of this wonderful news that we're sharing with you guys, or in some cases not so wonderful, I guess, depending on what center you are and where you fall in some of this data. But I'm glad that you're joining us to learn some of the trends that are happening across the network. And I'm also very grateful to all of the centers who took the time to complete this survey. I know that it's a lot of information that we ask, but I think that it's really valuable for us and for the centers when we're able to share it back out with the network. So thank you for the time that you invested in filling out the survey back in the fall. So I'm going to talk a little bit about some of the ways that centers are measuring their quality and how they're defining quality within their centers. We kind of look at that when we've put the survey together in two categories. There's efficiencies and KPIs related to contact center management, and then there's more of the clinical best practices that are actually used on the hotline when callers are calling into the Lifeline. And so I'm going to first talk just a bit about those call center metrics. One of the challenges that the Lifeline has faced historically is that because we are a network of centers, we have centers that are using different telephone systems all across the network, which makes it difficult for us sometimes in terms of routing calls most efficiently, as well as getting reports back from centers on what's happening within their centers. But automatic call distribution systems are really important at local centers in helping to determine your efficiencies. You all probably, hopefully, got a copy of our call center metrics paper that went out a few months ago, and we talked really in detail about the importance of understanding what's happening at your center in terms of call metrics. So it was interesting when we asked this question to find out that it was almost half and half of centers that were using an ACD versus centers that don't even have an ACD. And oftentimes centers that don't have the ACD, it makes it much more difficult to measure things about like abandoned calls that are abandoned and how long it takes for a caller to wait until they're connected with a counselor and such. So really seeing kind of a half and half, almost half and half divide there in terms of centers who are using ACDs and not using ACDs. And then when we look at that according to ACDs use on the Lifeline, we find that many centers are not using their ACD on the Lifeline. The majority of them aren't. And the hope behind that, I think, is so that callers can be connected to a counselor right away. But we know that in some centers, they might not have counselors available right away. And so the ACD is a way for them to wait in a queue until a counselor is available. We can go to the next slide, Tom. We asked a little bit about what kind of staffing that centers were using to answer the calls in their center, and we're seeing that about 97%, so almost all of our centers have some sort of paid staff or supervisors. So either on the front lines or in the supervisory level, almost all centers are having some sort of paid staff. And then about 55% of centers, and these are certainly not mutually exclusive questions, but about 55% of our centers also have volunteer staff that complement or supplement the staff on their lines or in supervisory positions. And we can go on to the next one, Tom. We asked a little bit about, oftentimes we get questions from funders and entities out in the stakeholders in the Lifeline, asking what kind of training or background is required for staffing for the Lifeline. And of course, we don't dictate the level of education that is required, but you can see here that most of the centers, about 20 to 70% have a bachelor's degree, only 5 to 30% are having a master's degree. But it's really not so much the degree that's required at a center, but the level of training and the expectations in terms of training, and as well as quality improvement procedures that allow real quality on the line. So if we take a look at the next one, we'll talk about that in a minute. I think on the next slide, we're just really, if you want to advance the slide, Tom, looking to the number of staff that are available in a call center. The averages here were really spread across the board, because we've got some centers who are very small, and we've got other other centers that are very large. And so the average minimum number of staff that we were seeing was about 2 to 6, with sometimes there just being one person on at any given time. The maximum average of staff at a center at any given time was between 4 and 12, again with the minimum being 1, but the max being up to 46 people at the same time. So you can see that that average really varies greatly depending on the size of the center and the number of calls that are coming in. We can go to the next slide. One of the ways that I know some of the centers are able to handle the increases in call volume is to allow some of their centers staff to work remotely. So in 2011, we saw about 18% of our centers doing that. In 2018, it didn't grow very much, only to 20%. I was actually surprised to see that that didn't grow as much, because I know that remote staff work is really a way to allow to attract counselors into working on the call center who might not otherwise be able to come in day to day and give some flexibility in their work. We can go to the next slide. So what are centers doing in terms of ensuring that their staff are adequately trained to answer calls that come in? You can see on that first bullet there that on average, there's a lot of training that staff and volunteers are required to participate in to be answering the hotlines in our various centers, about 80 to 100 hours on average. So that's a lot of training. And they're doing this in a lot of different ways. Many of our centers have individual trainings that they've put together, and a lot of times they're supplemented with some of the more standardized trainings. So you see, of course, the Lifeline offers assist to our centers, and about 69% of our centers are using assist in their centers. About 34% using QPR, 30% using Safe Talk, and about 50% are offering mental health first aid to their crisis hotline counselors. We can move on, Tom. So initial training is really important in helping to make sure that the counselors are doing the best work on the lines, but as we all know, it's not only important to train them well, but also to make sure that counselors then get the ongoing support and supervision that they need in order to continue to provide quality services on the hotline. And of course, obviously, these are also not mutually exclusive, but we see almost 100% of the centers doing on-site observation of calls, reviewing call documentations, providing refresher training. A little less, but about 70% or so are doing regular silent call monitoring, about 60% doing peer-to-peer monitoring, and some are doing reviews, about 50% of recorded calls. So I was really happy to see so many strong methods for ensuring quality at the centers. We can go on to the next one. One of the things that I think is fantastic about the centers that are doing work within the Lifeline is that what we often see is the best practices that we've been able to garner from evaluations sponsored by SAMHSA. So Maddie and Brian Mashara and John Califat and others who've evaluated the work of the Lifeline have allowed us to put together our Lifeline best practices. And most of our centers have indicated, about 86% of our centers have indicated that these best practices are not just being used on calls on the Lifeline, but they're able to disseminate these best practices much broader across their agencies. So we're really happy to know that these best practices are impacting people at risk of suicide well beyond the calls that are on the Lifeline. We've also ask people how many people are using our Lifeline simulation training. So our simulation training is an online training that allows an individual to simulate what it might be like to actually take a real call, and requires them to respond to a caller in distress virtually. Only about 38% of our centers are using that simulation training right now, which is actually lower than we would like. We are in the process of actually doing a major upgrade to our Lifeline simulation training, and you'll see some more information about that coming out probably at the end of the summer or in the fall. And I really hope that these improvements in the system was already great, but I really hope that the improvements and enhancements in the system will entice centers to use it even more in their crisis centers, because I think it's a really great tool. So look forward to that coming out soon. We can go on. So we asked some other questions about, just what are some of the other services that our Lifeline centers, our crisis centers are providing in their community, because we know that our crisis centers oftentimes really form the foundation of suicide prevention services in their local communities. And what we found is that about 80% of our Lifeline centers are reporting that they initiate follow-up calls as part of their services on the hotline. About 78% are providing trainings to the public, so beyond the staff on the lines, but out in the community as well. 71% of our centers are providing services for suicide loss survivors, and about 70% are providing training to emergency or crisis service providers in their community, so emergency department workers or law enforcement and others who are first responders on the front lines, providing training for them in suicide prevention. As the foundation of suicide prevention in the community, we are always, of course, encouraging our centers to have strong relationships with the services in their local community. It's important for centers to be able to do that especially when you're working with individuals who may be at imminent risk, and having strong relationships with individuals who may be able to intervene when that's necessary, especially in a way that's less intrusive than other services might be. So having that relationship ahead of time is really key. And we're seeing that most of our centers, so probably about 75% or so of our centers, have some sort of relationship with their mobile crisis team, which is fantastic. I suspect that those that don't have a relationship might not have a mobile crisis team. I'm not sure, but a lot of communities are still waiting to get mobile crisis teams in place in the smaller, more rural areas. So it was heartening to see that many have those relationships with their mobile crisis team. And then if you take a look at those that have relationships with emergency departments, that number's even higher. We're at almost 85% of centers who are working with their local emergency department, which is fantastic. We can take a look at the next one. Continuing in that same vein, in terms of crisis center partnerships, centers who have relationships with their local EMTs or ambulance workers, again, pretty strong there, about almost 75%. And those who have relationships with 911, this is really fantastic. Almost 95% of our centers have some sort of either formal or informal relationship with 911. And you all may be aware of our NENA document, our policies and procedures, standard operating procedures for NENA, which is the National Emergency Number Association, that kind of a professional organization that pulls together 911 and other public service, I forgot what the A stands for, PSAPs. Public Service Answering Points. Thank you. Sorry about that. So we encourage all of our centers, and I'm glad to see that so many centers have a relationship with 911, and look forward to a new and revised NENA SOP that we'll be putting out in the next year or so, maybe less than a year, for additional ways that you can continue to establish relationships with your 911 center. We can take a look at the next one. So what are you all doing in terms of public awareness and really letting people know about what's going on in your center? Seeing lots of centers that are very active on social media in one way or another, the majority on Facebook, others on Twitter and Instagram, less on YouTube or Snapchat or some other type of social media. And then, of course, we've got many who are doing the more traditional types of ways to promote themselves in the community through community events, promotional materials, flyers, or in the newspaper. I think that there may be one more slide. Yeah. And so, of course, we're always so grateful. There would be no Lifeline. As I've always said, there will be no Lifeline without all of our centers, the 170 centers across the country that make up the National Suicide Prevention Lifeline. And we're always trying to do all of the things that we can do to ensure that you're satisfied with being a member of the Lifeline. And happy to report that about 85% of you guys are indicating that you're extremely satisfied or satisfied with your relationship with the Lifeline and your membership as part of the network. Some of you maybe are having struggles. About 15% are neutral, 4% are somewhat dissatisfied. My guess is that might relate back to capacity challenges that John was talking about earlier, and the fact that there's more and more calls coming in and still struggling to find ways to handle those calls. But again, Happy that most of you are satisfied with your membership with the Lifeline and want to extend, of course, a welcoming ear to anything that you might not be satisfied with. Please feel free to reach out to myself or Tom or John or anybody that you have a connection with at the Lifeline. We're always wanting to hear your feedback on anything that we can be doing better to support you. So I think Tom's going to talk about next steps, and then we'll take some question and answers.
Yep, thank you, Sherry and John. So as you all saw, I'm pretty excited by the data we were able to pull from this last survey, and I want to make sure I help you understand that this is not the only thing that we're going to be sharing about these results. So today we've had this webinar where we were able to discuss a lot of the key findings, a lot of the most important things that we were able to glean from the results. And we're going to put this webinar up on the Lifeline Network Resource Center, and I will share this around in our newsletter and in our Facebook group, so that way you guys can review the webinar again, or if you have a colleague who would like to check it out and couldn't attend today, they can do so as well. We're going to use this survey data to be seeking more information and resources for sharing. So we're going to build upon the data that we've gotten in this last year from this survey to really support and help craft the initiatives and the things that we want to do to help support you guys moving forward in the next few years. We're going to be having a blog post coming out in the next week or 2 weeks that is also going to summarize this. So for some easy reading to see some of the essential findings that we had from this survey, as well as some key points and some recommendations on how you can use this data as well. As you speak with your stakeholders, as you continue to promote the services that you guys have and the relationship that you have with the Lifeline. We're going to have some incorporation into media talking points and public resources as supported by these data. And I'm sure that for those especially who were able to complete the survey for us, you know that it took some time. It was a long survey. There were a lot of questions asked, and we didn't get to all of that. And you may be scratching your head wondering about that particular question that interested you in the survey, or that what findings maybe came from a collection of the correlations that we might have seen in the survey. Rest assured, this is not the only time you're going to be able to see these results. We're going to have the full comprehensive survey report coming out optimistically within the month of July. We want to make sure that we have all of the information that we want to share cleaned up and ready to go for you guys, but there will be a full report for you to review everything that we were able to learn from this survey. And with that, so I want to make sure that we take an opportunity for anybody who's paying attention today to share any questions or comments, things they'd like to know a little bit more about. We have some time. It was nice and succinct this afternoon, so we have a little time to discuss anything that is on your minds. Feel free to use the question and answer box and or the chat box, whichever is easiest for you, to share some of the things you'd like to talk about. And Sherry, John, and myself are happy to respond. Thank you, Ron. I realize that I do need to water these plants, and I'll get to them as soon as I can. Very thoughtful of you.
Or just purchase some cacti, I think.
I'm seeing some questions come in on the QA. I'm not sure how that's different than the chat, but we did get a question. What is N11? John, maybe you wanted to spend a little time on that, or did we answer that already?
I don't think we have. I mean, it's sort of been talked about a great deal in various ways, but I think a lot of folks have been hearing in one way or another a proposal from, actually it was a National Suicide Hotline Improvement Act. It was a law that was passed a year ago that would require a feasibility study to be done by the FCC alongside the Veterans Crisis Line, SAMHSA, and the North American Numbering Council, and as well as posted comments from the public to see what we thought what would happen if there was a 3-digit N11 number, meaning something like 911, could be 611, and some have proposed 211 being repurposed or extended. But if we used one of those N11 numbers to become the new Lifeline number, it wouldn't it wouldn't replace the 800-273-8255, but it would be theoretically the number that would be most prominently advertised and marketed. So at this point, it's most of the reports, I believe all of them are in to the FCC. The FCC has to report to SAMHSA, to Congress by the 14th of August. Their recommendations based on all the other reports that have come into them, the public responses and letters that they've received. And based on that write-up that they will provide to Congress, I think after that will be a period of public posting, probably of a few weeks, where the public will get a chance to comment on their recommendations. And all of this, I think, happens in mid-August when Congress is typically on recess. So I wouldn't expect if Congress is even going to act on it, that they're going to act on it immediately. There'll be probably at least fall before if they're going to hold hearings on it. So it's still a long road ahead as to determine whether or not there's going to be a 3-digit number for the Lifeline or what kind of infrastructure is required for that. But the first major step in that direction is going to be provided to Congress in a report from the FCC in mid-August.
Thanks, John. We're getting some other questions there in the chat on the side as well. Merrill asked, do we think that there are funding opportunities on the horizon?
I feel quite certain there are. We're going to do whatever we can to promote those. Very soon we'll be announcing a grant program that's going to be stimulating. It's going to be seeking to stimulate more funding of local crisis centers in our network in states where they're not getting paid at all for Lifeline calls, and there's a lot of calls being generated from those states. So that hopefully will stimulate a lot more funding. Stay tuned for that. We'll be announcing that probably in the next 2 to 3 weeks. But that's just the beginning. Really, it's kind of we're putting an all points bulletin out to all of our stakeholders and friends that we've got to do everything we can to support our local Lifeline crisis centers. So the American Foundation Suicide Prevention has also been provided with a lot of data that will enable them to start advocating for local crisis centers. And we've said your first step, your first call, AFSP chapters, is to contact the local crisis center and say, what do you need? Do you need us to help you promote funding? Do you need volunteers? What can we do to help? So that's something else that we're going to be talking more about over the coming months. I think we'll be planning a joint webinar with AFSP to talk about how we can get local Lifeline centers and AFSP chapters to work more together to promote Lifeline center needs. So those are among some of the more immediate ones. But what we're seeing, I think, is our continuing increase in funds for crisis centers. Our biggest challenge is, don't forget about the Lifeline calls when you are providing more funding for our centers. My guess is we'll see even more funding increases this next year for centers. So we want to make sure that Lifeline calls are always in those discussions.
I see Merrill had another question, wondering if the increase in government funding for larger centers is attributable to Medicaid reimbursements for crisis hotline services.
You can break that down. You want to talk about that?
Yeah, I'm not sure I know the answer, and so certainly jump in, John. I don't think we broke that down specifically. My guess would be that the overwhelming increase is probably not attributed to that. I know that there are some centers that have been successful in getting calls for their crisis hotline reimbursed, and but I don't think the overwhelming majority have been able to do that yet. We did have a webinar, actually, I think it was just last week, was it, John, with Tom, with the National Council that Matt did about other funding streams. So there are some examples of centers out there that are doing that, but I don't think we've gotten to the point where that would be the majority of the increase in funding. I don't know if you agree, John.
No, I agree. We didn't break it out. We don't know for sure, but what we do know is that There's a lot of things that we've heard that states are doing to provide more funds to crisis centers, with or without Lifeline calls being funded. But certainly the zero suicide movement and how that's affected this new, certified community behavioral health centers and some of the requirements that also seem to require hotline work. There's funding that flows through that. There's funding that now can be made available in different ways to the block grant if you know how to use those. There's ways that you can use the Medicaid funding that's noted. But we're also hearing more and more, and perhaps this is due to some of the work that NASHBID and our partners have been doing and helping us amplify the need for crisis centers and crisis now specifically. I think a lot of that has gone a long way towards really reversing a sense of priority for crisis center funding. I think there was a period where that many crisis centers were just relegated to the back burner, but I think they're being seen as a means for cost efficiently assisting a larger number of people who could be in crisis and getting them into the system in more efficient ways.
Thanks, John. I see another question from VT211. I'm guessing that's Vermont 211. Could you perhaps review, is that a majority of centers use an ACD for Lifeline calls or that a majority do not? The majority do not use an ACD for Lifeline calls. When we take a look at the survey, I'd have to go back to that slide, but I think it said about 20%.
Can you go back to that slide for a minute, Sherry? Because I think that there is a need to clarify that. I was confused by that as well. So it looks like to me that 81%.
Oh, I did it backwards, didn't I?
Yeah. So I think that was important to clarify.
Thank you, Vermont, and thank you, John, for that. On my screen, I just thought that the darker color was in the same order on the key there, so I read that wrong, and I apologize for that. But still, overall, the majority of centers don't use an ACD on their Lifeline calls if you look at the Lifeline centers as a whole, because only 54% of them have ACDs. But if you take the 54% that have ACDs, about 81% of them are using their ACD for Lifeline calls, and 19% are not. I apologize for reading that backwards. Yes, thank you, Vermont 211. Glad you're here. Other questions? We just learned math. Don't learn it from me. Other questions that you all have today for us? All right. Well, if there are no other questions, I don't see any others in the QA box either.
One thing I do want to, and it's probably doesn't need to be underscored, but, and I'll mention it again in an upcoming blog that will accompany the release of this webinar that's recorded for people who haven't seen it, as well as the slides themselves will be PDF for people. But I want to just underscore that this is something that will be useful for you all too, in whatever advocacy that you may need or want to make to local stakeholders who will want to know how do your services stack up in some ways to the network at large? How does it compare to others? And you might be able to effectively argue that there's other states that are prioritizing their crisis center work. Why aren't we? And say, look, there's so many that are providing chat and text, and why aren't we? There's a growing increase in the number of centers that are receiving funds in this category, and there's more that are providing mobile crisis services. Why aren't we? So as you begin to formulate your arguments, you may ask us, hey, by the way, do you have any more data that might be helpful for us to formulate this argument for this particular point based on what you have in the survey? So feel free to ask us if you see the report, if there's something that you feel like you could use that would be more helpful for you, that may not be maybe more granular than the more global report provides. So if you need any help in trying to formulate arguments with data that compares your services to other facets of the network, feel free to do so.
And just to add to that, just stay tuned for those additional resources that John's referring to and Tom summarized earlier. We hope to get you all the full report, the recording of this webinar, John's blog, out in the next few weeks. So stay tuned for that and let us know if there's anything we can do to help you to interpret or disseminate that better, more effectively. We're happy to do that.
Yep, like Sherry said, we have those materials coming out in the next couple of weeks. If you haven't already, please be sure to subscribe to our newsletter, check out the NRC, feel free to join our Network Center's Facebook group, and most importantly, first and foremostly, our email distribution list. That's where a lot of these webinar invitations, a lot of our media alerts, any funding opportunities, RFP opportunities, those are going to be going to you by email primarily. They'll be shared on the other communication channels, but certainly if you're not on that distro list and you haven't been receiving messages from us, let me know. I got my email right here, and feel free to ask me any questions about this presentation, or if you'd like the slides or whatever you may want to know or ask about regarding this and more. I'm happy to help and support you all. And with that, thank you again for joining us today, and have a great afternoon, everybody.
Bye-bye.
Well, bye-bye.